The following program is a paid presentation for American Medicine Today. The information and opinions expressed are solely those of American Medicine Today and are not the opinions of the station, its affiliates, management, or employees.
Coming up on American Medicine Today.
Traditional therapy for autism can be very expensive, timely, and hard to come by. Colleen Sullivan created Autism Lizard as an advanced, more affordable online delivery option for ABA therapy. We take a look into the life of Andy Dassing and see how the Bonati's exclusive precision procedures have changed his life. Next, we speak with Cynthia Stamer about how physicians can take control of quality of care back from insurance companies and the government. How does this affect you? Find out coming up on American Medicine Today.
Featuring cutting-edge science and medical innovations, touching personal stories of recovery from pain, and political issues plaguing our healthcare. This is American Medicine Today. Brought to you by the Bonati Spine Institute and Alfred Bonati, MD.
Colleen Sullivan is the co-founder of Autism Lizard, a tailored, on-demand video solution for parents raising children with autism and other related disabilities. Thanks for joining us, Colleen.
Thank you, Kimberly. Thank you, Ethan.
You're welcome. It's a very interesting story. You have an adopted son who happens to be autistic. It's a very long but interesting story how you came to develop Autism Lizard. Why don't you fill us in?
When we adopted our son about 6 years ago, immediately he went into ABA therapy.
ABA therapy is the gold standard in therapy, recommended by everyone from the American Association of Pediatrics, Neurology, and Psychology to the U.S. Surgeon General. It has proven to allow autistic children to thrive and ultimately become independent.
So we were in therapy for 4 years, and it wasn't until year 4 that I said, to the therapist, I really don't feel like I'm adding any value to any of these table sittings where we're doing therapy. And she said, no, Colleen, we've been taking data on you for about a year, and we're seeing that you're not executing the parent techniques the way that you should be.
And did you have any idea you were supposed to be doing that?
I said, I'm here, I'm present, I'm participating in everything that we're supposed to be doing. I don't understand. Could you give me a very specific list of what I'm supposed to be doing? Certainly I'm present.
The very next day, the therapist came in with a 20-point list of what Colleen should have been doing.
And I said, this is the most beautiful list. I mean, I'm ready to go. We started executing these techniques, and I would ask her, well, I don't understand this one. Can you model this one for me? And she would model it for me, and then every 15 minutes we would stop the clock, and she would say, I like how you did this, I don't like how you did this, do this. And my child thrived more in 2 to 3 weeks than he had in the 4 years.
It must have been quite a revelation when you finally learned what you needed, but didn't it make you a little bit sad and wondering how many other families were going through that same predicament where they think they're doing right by their child? They're sitting side by side with them, learning these techniques, but then it almost seems like they should be able to run with it and, okay, you're done with your part. You didn't realize you had to be implementing these things
I
throughout
didn't
the day.
realize. Granted, she had mentioned, give your son choices. Well, okay, well, do you want chicken or hot dogs? Okay, I give him a choice today. We're good. I didn't realize that part of the evidence-based ABA therapy, again, that all the pediatricians, neurologists, psychiatrists are all on board with, say there's 3 parts. There's the child part with the therapist, there's the parent component, and then there's the community and teacher component.
After studying ABA therapy, Colleen learned that most children are not getting all 3 components.
The gold standard for these children is 25 to 40 hours per week of this therapy.
That's basically a full-time job of getting therapy.
Yeah, for 1 to 3 years.
It's also quite expensive, ranging from $50 to $150 per hour.
That helps me now understand why the parent is involved, because there's a huge imbalance of therapists versus children with autism.
3.5 million people in America have autism, and there are only about 17,000 board-certified behavior analysis therapists.
And that's when I went to now our co-founder, Laura, who is one of these board-certified behavior analysts, and I said, am I missing something? We could be putting a lot of this on videotape. We could be getting this out to the world, to these parents. It's one of the components anyways.
So one of the biggest goals is really to make sure that everyone that's involved with a child, from nannies to babysitters to grandmas and grandpas, aunts and uncles, if you're working on a skill and the goal is to have maybe the child request for things, the goal is that everyone waits for those words to be used so that the child is then asking for the actual items, and everyone knows, oh, we're not going to give it to them because they have cute dimples, they're giving it to them because they used, I want milk. The more parents have in their toolbox of strategies on dealing with maladaptive behaviors and or skill deficits, programs like Autism Lizard are going to bring that to the fingertips of family members on their cell phones, their iPads, their computers. It's guided and designed by behavior analysts, and the goal is to really get those interventions in the family's hands while they're waiting for that next certified analyst to be available.
When we created this, the goal was do what we can to get some of these children or the parents of these children educated, because since the parent component is part of it anyways, let's attack that part.
She realized that she could post videos online that would be specifically tailored to the individual needs.
And Autism Lizard is able to use the clinical intake form that we have on the website and be able to create the video curriculum for that parent to help that child, specifically tailored to that child.
So you started making your own videos, correct?
Right.
And then you realized, hey, other parents could utilize this and benefit from that.
Right. So immediately we started taping whenever my son and I were interacting. And it's really neat because our story is, let's help Jimmy and Johnny. And Jimmy and Johnny is our made up two children that need help. And so Jake will do good things for the camera, do bad things for the camera, but either way are good, because it shows the parent, when you're in this situation, here's what you need to do and what ABA therapy technique you could be using to get your child back to where he needs to be or she needs to be. It is what I equate to a different language. You have to be trained when to say certain things to your child, when to praise them, when not to praise them, when to pull back. It's a different technique.
Let's talk about some of those techniques that are featured on Autism Lizard that parents can actually learn to do to take away.
Okay, so one that I love that I always show is called behavior specific praise. So with my typically developing son, if he were to put on his shoes, I'd say, great job, or thanks for doing that. It would be quick, it would be easy, he would know what I'm talking about because he just put his shoes on.
Right.
Well, with my son who happens to have autism, I have to say, first brush your teeth, then put your shoes on. Two-step process. And then when he puts his shoes on, I need to say, thank you for putting your shoes on. So with enough of that repetition, behavior-specific praise, what did the child do that we are praising? So he knows, Mom likes it when I put my shoes on the first time she asks. Okay. And if I say that 100 times in a month, thank you for putting your shoes on.
May I please have a break? Absolutely. Thank you for doing your alphabet with me. It's now your break time.
And so we need to be very specific about what we're praising. I like the way you turned the TV off the first time I asked. Oh, she likes it the first time. Your
It's a lot of
training
positive
skills.
reinforcement,
Yes,
basically.
yes. Your training skills to the child. And so that's how, in this technique, for example, you're training the child to do what society expects. Another one is choices, which I think we'll cover today. Clinically, and per all the studies, when you give a child choices, and in autism and other related disabilities, well, now that child has made a decision. We need to teach them how to make decisions, be independent. Also, what happens per the studies is that they now feel in control, and over time, behavior would lessen.
Choices can literally be made from anything. Say you cut their French toast in half, then ask which half they would like to eat first.
You want me to catch you or push?
Catch me.
Gotcha. Ready, set, go.
The therapist told me 4 years ago, make sure to give your son choices. I said, I did, hot dog or chicken that day.
Right.
Choice, checked off the box. I didn't understand this was a new language that had to be implemented 24 hours a day, 7 days a week from the parent and hopefully the teacher the guidance counselor, everybody has to be on the same page.
Autism Lizard also has a component where the child's teacher can log in and watch the same videos and curriculums tailored to the child that the parent does.
So we're very effectively leveraging technology in order to get everybody on the same page.
Okay.
Now, how did you come up with the name Autism Lizard?
Autism because my son happens to have autism, and I realized this is what can work for children. And lizard because he simply loves lizards. That's really who this was created for and in honor of. So it had to go with something that he loved.
And so is Autism Lizard meant to be used in conjunction with therapy, or is it stand alone where, because I got to imagine it's a heck of a lot cheaper than it would be to pay, the $50 to $100 an hour.
Yep. And well, I'm going to answer it based on how a developmental pediatrician told me. A developmental pediatrician told me here in Tampa that she saw this as a supplement to children that already have ABA therapy for the parent component that likely is they're not getting to it, and a primary for people that have no therapy ability.
So people on a waiting list.
On
like
a waiting
that.
list.
Yeah.
And that was from the developmental pediatrician who said that.
While not a complete substitute for ABA therapy, Colleen Sullivan's Autism Lizard is certainly helping fill in the gaps for thousands of parents of disabled or learning impaired children around the nation. Visit autismlizard.com for more details.
Thank you, Colleen, for these advanced therapeutic strategies that are helping our children and teaching parents that they can access these strategies anywhere in the world. Make sure you stay tuned, because coming up after the break, our Back to Life segment. Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect 98.75% patient satisfaction. 50,000 successful procedures have been performed exclusively at our location. Over half our patients have suffered from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail. Andy Dassing describes himself as a hyperactive Type A personality. His current passion is teaching programming and robotics to children in both elementary and middle school. At home, he enjoys running around the yard with his dogs, playing with his granddaughter, and completing projects around the house, including woodworking and glass art.
I live in Florida. I've been here since 1983. Came down on vacation and on a whim took an interview, and they hired me on the spot, and within 20 minutes I became a Floridian and have been here ever since. One of my favorite hobbies is being a stained glass artist. It involves sometimes sitting for periods and sometimes standing, depending on the type of work that goes on. My wife and I are both artists, and we love just hanging out together in our little workshop areas and talking and putting the music on and spending time together.
But just over a year ago, a surprise pain began affecting his quality of life.
The pain started almost overnight. I had been doing nothing in particular the day before, but when I woke up one morning, my sciatic area and hip and down the side of my leg and groin area were very sensitive. The pain level increased steadily over the next few weeks. I thought it was a strain. I went to see my general practitioner, and he said, just take it easy, ice and heat, and see how that goes. Some ibuprofen type drugs, and I let it go for about another month and a half, 2 months. Was not getting any better. The pain that I felt was a stabbing pain. It was whenever I would move a certain way, it would start in my lower back and radiate down the left side of my leg, almost past my knee. And it was the kind of pain that after a while, you try and live with it by not moving a certain way. And then it got to the point where I just decided to stop moving. And I would minimally relocate from chair to chair to try and find a comfortable position.
Before considering surgical options for his pain, Andy received injections.
I had 3 lower lumbar injections with steroid, and I had a left hip injection into the hip socket to see if steroid and pain medication was going to have any effect there. Both the back injection and the hip injection lasted no more than a week, and then the symptoms were back in full force.
Disappointed that traditional methods would not eliminate his pain, he visited other orthopedic facilities.
So I went to see a hip orthopedic surgeon, and he said, "You look like a candidate for a hip replacement." And I wasn't too happy about that news. I waited another couple of months. The pain still got worse. I got to the point where I was so debilitated that I had no choice but to go and see another hip surgeon who also said, "Yeah, you're probably a candidate for hip pain." Until I mentioned, "It gets worse when I lay down." He said, "Oh, that's an interesting thing. It should get better when you lay down and take the weight off." At that point, I decided it was probably best to go and get my back MRI'd. They did that and found some issues there.
Just after his MRI, Andy saw a commercial for the Bonati Spine Institute, and he decided to submit his information for a free MRI review.
I met with Dr. Bonati the first time. He looked at the MRI. He said, "Let me give you a couple of scenarios on how you're feeling, and you tell me which one fits." And he came up with 3 scenarios, and on the third one, he hit it on the head. About how the pain comes, how it goes, what I can do to make it feel better. He looked right at the MRI, and it didn't take long. He said, "I wish I had better news for you, but you need 3 procedures. You have these 3 areas that are impinging on your spinal column, and you're not going to get relief until we do these procedures." What I really appreciate about Bonati is the detailed explanation of what they're going to do and what you're going to feel afterwards. They gave me cautions and said, "You're going to feel really good in one certain area after your first procedure, but it may cause other areas to feel worse because you're no longer blocking the pain from those areas." Just knowing that made it easier that when I did feel better in one area, I wasn't disappointed that it felt worse in another area because it was explained to me. And then after the second procedure, it got better, but one specific area was still really bad. And then after the third procedure, it was like, "Oh, this is great."
Only 2 months after his initial consultation, Andy completed his Bonati Spine procedure surgical summary in December 2016.
The progress after each procedure was amazingly good. The 40-minute walk right after surgery was a shock at first, that I was being told to do this right after a spine surgery. But after the first day, it became second nature. After the second procedure, the idea of walking, I was almost excited to get up and walk to see how the new procedure felt and how much more relief I was going to get after each one of those. The recovery, all told, has been phenomenal. When people at work see me walking now without a limp, with a smile on my face, they see that there's a benefit. And several people have asked me, "What did you do? Where did you go? Who did you see?" And I'm more than happy to tell them that the Bonati Spine Institute is the place to go.
Should anyone be wondering if the Bonati Spine Institute can help eliminate chronic pain, Bonati's patient advocates, surgeons, and staff members are always available to help.
The people there are just so caring. You're not a number, you're not a dollar sign. They really care about what it's going to take to make you feel better. And I think that without question, everybody there has that same work ethic, has that same mindset. I just want to say a big thank you to Dr. Bonati and his team over at the Bonati Spine Institute. From day one until the end of my last procedure, they've taken care of me like I was family. The outcome is more than I would have expected. And if there's anybody out there who is considering any type of pain relief, back surgery, please go and see the Bonati Spine Institute.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact, I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Oh, to be a fly on the wall here at American Medicine Today. I'm Kimberly Brumilla, joined by Ethan Euchre.
Glad to be here.
Jeff Wagstaff.
I think I may have something to do with that comment. Good day.
And world-renowned orthopedic surgeon Dr. Alfred Bonati of the Bonati Spine Institute. Joining us right now is Cindy Stamer, a board-certified labor and employment attorney whose recent article describes how physicians need to take back control over quality in medicine, and she's here to discuss that. So thank you for being here with us, Cindy.
Good morning. How are you, Kimberly?
Good.
We're doing well. Now, Cindy, I know that you and Dr. Bonati can probably speak for hours on this topic, but you got to kind of dumb it down for the rest of us, including the audience, I'm assuming, those that aren't doctors or healthcare industry workers.
Correct.
A lot of minutia here, but this topic in particular, what is the PQRS system and why is it demonizing physicians?
PQRS is a government initiative to define quality tied to reimbursement through Medicare by having physicians follow quality guidelines that are set and imposed by the government and tying that to reimbursement and their eligibility to practice, and also it's tied into the ability of the government and private payers to efficiently process claims because they basically have these generic standards set and expect doctors to practice within them. So what they're doing is giving bonuses on one hand, very small bonuses for physicians that participate in this quality reporting and measurement process in the Medicare system. But at the same time, those quality standards are also being promoted as the new measures of quality for care. So while they're intended and presented as primarily for reimbursement, in fact, physicians are being judged if they exceed the quality of care or if they don't score as well or don't participate at all in these quality measures. Aside from reimbursement, the reason that partially happens is because they're also advertising the availability of some of this data to insurers as well as patients.
Cynthia, how is possible that this is happening and it's not American Medical Association in the middle of this thing and stop this like a break in a car? Now, I know the American Medical Association is already sold to the government because they have a code system that they are being paid for, and then they are practically servants of the government. Now, the system here is that we need to create something on the side. We need to create a defense mechanism where the government or the insurance companies have nothing to do with the physicians delivering healthcare. To do that, or we need to create an insurance company that provides the system, or we need to create an acceptance of all the physicians. For example, we should not take any governmental type of healthcare and any insurance that they don't provide a service in the way that we consider that is proper for treat the patients correctly. We should not recommend it. We should remove them.
Part of the Affordable Care Act reforms and some of the other related reforms that have happened are actually trying to work in direct opposition to what you're suggesting, Dr. Bonati. What is decided is under the Affordable Care Act, the real fundamental goal is to bring down the cost of health care by reducing the availability of quality care or lowering the standard of care. And to do that, the Obama administration and the Affordable Care Act actually extend these regulations through a variety of means, including PQRS, to even places in which physicians are not being reimbursed by Medicare, Medicaid, the government programs, or even private health insurance. So as you know, the Affordable Care Act also dictates certain standards for health care coverage, and it provides a number of other reforms that are basically designed not just to hit people that are getting paid by the government through these government programs, but even private pay where people, in other words, where patients pay cash. The reforms that are being made are putting pressure, and so you see the traditional places like medical boards, peer review, which is the quality process in hospitals and other medical practice areas, being adjusted in their quality standards to start treating care beyond what the government wants to be paid for as improper or over the utilization.
But Cynthia, we have everything in our hands. All these laws and all this regulation, all the things can go to the garbage can. We can just go and say we are not going to accept this, and that's it. And that's what physicians, they need to do. They need to go and say, none of these regulations apply to my practice. And if these regulations are not being removed, I'm not going to accept anything, and don't accept the payments from the government. Do not accept Medicare. Do not accept Medicaid. Do not accept Obamacare. And the insurance companies that they work with us, we accept those insurance companies. We will increase the amount of population going to those insurance companies, and the constituencies that they go there are going to make the insurance companies happy enough to allow us to practice good medicine. But we need to have a type of an organization that is going to provide this vehicle to allow the doctors to join and provide this defense mechanism. Meanwhile, we keep accepting laws created by the government or by the insurance, or by whoever is a provider, then we have a problem. And we need to remove that.
I've been working for the last several years as one of the Project COPE initiative involvements with the National Physicians Congress, which is attempting to preserve the opportunities within the existing law against attacks that would further restrict physicians' ability to work directly with patients to make quality and care decisions, as well as to try to roll back some of these laws like the Stark, Fraud and Abuse, PQRS, and quality reporting, those kinds of things, because it's very difficult for physicians to stand on the sideline. And a good example of this is some of the recent attacks on physicians and healthcare systems and physician-owned hospitals, where they attack them even when they're not accepting Medicare, Medicaid, or insurance for quality and healthcare fraud initiative. There's a real effort to put the screws on physicians and patients being able to make quality of care decisions between the two of them, because by definition, if you allow physicians and patients to continue to make choices based for care, based upon what is best for the patient without regard to what the government says, the quality of care that exists in a direct patient-physician relationship by definition often becomes an indictment on the limited quality of care within these highly regulated systems. And at this point, private health insurance is regulated as much as Medicare by virtue of the reforms of the Affordable Care Act.
You were right. Obamacare certainly succeeded in lowering the standard of care available to people, and especially in doing so by creating healthcare providers or medical providers where they're getting people other than trained doctors to give medical advice and treatment to patients. This is a topic that we're all very passionate about, and we'd love to have you back. Thank you so much for joining us on the program.
Thanks for including me.
You're welcome.
Right,
Thank you very much. That's such an important topic. Well, that about wraps up our program. Make sure you stay tuned next time. Thanks for watching American Medicine Today. If you have any comments or questions, contact us at the number below. You can tweet at Dr. Bonati using hashtag American Medicine Today or hashtag AMT. We would like to hear from you.
The preceding program was a paid presentation for American Medicine Today. The information and opinions expressed are solely those of American Medicine Today and are not